Welcome to the Jeremiah Patterson Show, and thank you for joining me. This is a TJPS special report. America's public health agencies dismantled. Do you like the new background? It's something different that we're trying out here, but let me know if you enjoy it in the comments. New space, so new background. We'll see if it sticks, if it works. If not, then I'll just go back to something different or change it up, but let me know what you think about it. But I'm bringing you this special report about the assault on public health agencies because it is imperative. There is a lot of focus on the other things that are happening under the Trump administration regarding mass deportation, the assault on the rule of law, and all of that is essential. It is. But what has happened to the public health agencies in this country in terms of eviscerating it at its substance and completely disregarding, public health outbreaks that are happening across the country is something that deserves more national attention. It is something that deserves more attention in the mainstream press. This is why we're covering it here on the Jeremiah Patterson Show, because we are independent news. But this is a story that's important. It is worth telling, and it is something that absolutely is going to have lethal complications for everyone involved across the country. In just 107 days, Donald Trump, RFK Jr., and others have launched a historic assault on public health agencies in the United States. The CDC has been muzzled. The FDA has been pressured. Essential programs, experts, and panels are gone. Actions, essentially, that will result in devastating consequences, and many of them, according to experts that I've spoken to, are irreversible. RFK Jr., an anti-vaxxer, is leading HHS. Mehmet Oz, a conspiracy theorist looking to privatize Medicare and Medicaid, is leading the Centers for Medicare and Medicaid Services. And Susan Monterez, a pick that has CDC officials skeptical about whether she will politicize the agency. These are the chief leaders of America's public health agencies. And this is not just about failed policy. It is about complete betrayal, about lies dressed as truth, and authority weaponized against the people. The architects of public health have become its arsonists, torching trust, science, and safety from the inside out. And this is really something that needs to be covered more. And that is why we're doing a full special report here, because it is essential. And it's also very, very scary, quite frankly. I mean, it does not come as a surprise. It is no secret that Donald Trump does not value or respect our public health agencies. That was made evident during COVID by politicizing it, trying to silence officials and stop the release of certain reports, and promoting lethal conspiracy theories over sound, logical medical advice. But what is happening under his second term as president is so profoundly detrimental, I'm not sure we're going to recover from this. And in order to fully tell this story, we have to start with this. Because the wide-scale, deliberate dismantling of our public health agencies that is happening right now did not just come out of left field, nor is it being done without intention. All of it is fully anchored by Project 2025, this 900-page plan to restructure the government and destroy the status quo. In this conservative plan, there are multiple initiatives to completely change the way that public health agencies are operated. For one, Project 2025 recommends splitting the CDC into two separate entities, one focused solely on data collection and another with a, quote, severely confined ability to make policy recommendation. Emphasis on severely there, as they're trying to, essentially reshape the way that public health agencies operate. So this would effectively strip the CDC of its authority to issue public health guidance such as vaccine or mask recommendations, leaving such decisions to parents and medical providers. They also want to limit public health authority. In doing research for this report, I came across this website, which references what Project 2025 has planned for HHS, that is the Department of Health and Human Services. And according to this site, which I confirmed with the original plan, Section 3 of Project 2025 emphasizes the need to shift HHS's focus from promoting equity and addressing specific demographic groups to serving the health and well-being of all Americans. Key goals include protecting life, conscience, and bodily integrity, among others. Now, they say it's necessary to protect conscience rights and bodily integrity, and that we should reject, quote, harmful identity politics that promote gender identity over biological sex. This is from HHS. And what this would look like is an attack on reproductive rights, including the rollback of abortion access and related healthcare. And, it's also going to be quite detrimental. I mean, the emphasis on conscience rights would allow healthcare providers to withhold services on the basis of religious or moral objections, potentially resulting in reduced access to care for marginalized populations, including LGBTQ plus individuals. According to Project 2025assistant.org, this would exacerbate existing disparities among those groups. They then go on to cite how there is a possible constitutional conflict here and how states could even sue as a result of it being taken away. In addition, the Project 2025 vision for American healthcare looks like privatizing health programs that millions of people count on, restricting healthcare for LGBTQ individuals in marginalized communities, closing DEI offices within HHS, and limiting vaccine mandates, calling them, quote, irrational, destructive, un-American. This is Project 2025's vision for American healthcare, and vaccine mandates in their book is, quote, irrational, destructive, un-American. This plan also includes renaming HHS the Department of Life to emphasize its anti-abortion stance. All of this was public as of April 2023 when Project 2025 was released. And I started with that context because this really is something that is worth sort of following the money and going back to, like understanding this on a deeper level, because what's being done to the federal government is not just being done because someone woke up one day and decided, oh, let's slash a hammer to the federal government. Let's just start firing thousands of employees. No, it's being done with deliberation, and it is being done with a clear purpose in mind here. I mean, what they're doing to purge public health agencies in this country was all planned. In January, when Donald Trump took office on day one, as mentioned in Project 2025, he withdrew the United States from the World Health Organization, calling it corrupt. A day later, he announced a communications pause between health agencies and the public that meant no reports released and research grants would be frozen until February 1st. This was a memo by the then acting HHS Secretary Dorothy Fink. She's urging colleagues there to essentially refrain from issuing guidance, notices, announcements, press releases, or any correspondence with the public about anything. And of course, this was announced at a time when bird flu cases were rising across the country, and the CDC was doing very important work, tracking, recording, and then giving the information to the public so they were made aware about this. And it's not just, the public that relies on information from the CDC, from the MMWR report, but it's also public health agencies in other states across the country. But it's also medical professionals in states and cities and municipalities across the country that rely on the sound medical advice from our world premier health organizations that reside in this country. I spoke to Dr. Erwin Redlener, a public health expert, about this a couple months ago, and here's what he told me about the Trump administration's decision to stop communications with the public regarding all infectious disease reports, etc. From your perspective as someone who has, devoted your life's work to this, what is the danger of politicizing our health agencies and the risk to the public in not getting that information out there?
It's an incredibly dangerous and foolhardy guidance to give the CDC and other agencies. And it's not just the question of public information. It's the question of information for doctors who need that information to help understand what they're looking for, what they're screening for, what are the new treatments, what is the latest research that could help influence clinical decision-making. It is mind-boggling that the White House and Donald Trump would want to shut off those conduits of information for people, and like I said, especially for the medical and public health community. I'm not, other than the attempt to kind of influence political, ideological objectives, it makes no sense whatsoever, and it is in fact really, really dangerous.
The gag order was lifted, but as Dr. Redlener said, this was incredibly dangerous. RFK Jr., Donald Trump's pick to lead HHS, had his confirmation hearings in early February and was grilled on everything that he stands for, including saying that Americans want to get rid of Medicaid because there are too many premiums and deductibles. Just so that we're clear here, Medicaid does not have premiums or deductibles, but the nominee to lead HHS said that on live TV before senators. He then acted like all the conspiratorial things that he said and the epidemiological crises he created by being an anti-vaxxer advisor to high-profile leaders across the world did not happen. He also appeared to be confused by many of the questions asked and flat out said, "I don't know," in response to a federal law trumps state law when it comes to emergency abortion care. But ultimately, he was confirmed 52-48 to be the Secretary of Health and Human Services. Since then, it has been a disaster. One of the first major things that he downplayed was the measles outbreak in Texas after a 2-year-old child died. He said that we get measles outbreaks every year. For the record, we do not. They are sporadic because, of course, measles was declared eliminated in the United States back in 2000, so we only have small situations where we have cases among unvaccinated communities. As HHS Secretary, he then fired over 20,000 public health officials across agencies like the CDC, NIH, and FDA. In multiple cases, we have seen billions in research funding suspended or redirected. HHS dropped Medicare obesity coverage. Grants to universities for research have also been slashed. When asked why he's doing this and how the public would perceive it, this was his response.
Mr. Secretary, Stephen A. Smith here. Thank you for coming on the show. HHS reduced your employee status from 82,000 to 62,000 employees, if I remember correctly. Cut about $1.8 billion, but nevertheless, you got a lot of American citizens wondering how on earth are you going to ensure that we're going to become a healthier society with over 20,000 less employees to look over things and purview things to some degree. What do you say to that?
Well, I would say during the Biden administration, my agency grew by 38% and Americans got sicker.
That is false. There is no credible data to suggest that Americans got universally sicker under the Biden administration. According to this graph by the Centers for Disease Control, life expectancy actually improved under the Biden administration, and the uninsured rate for people who did not have health insurance coverage fell to a historic low, 7.7%. So, again, these are the people that are leading our public health agencies that are just spewing deliberately false, intentionally false information. He expands in this interview that essentially by saying we're hiring people who know how to do this, and there's too much going on at HHS, meaning he's saying essentially HHS is like a redundant agency. There are things that are in HHS that don't need to be there. Just to give you an outlook here of the damage that has been done, just look at this. I put this together, and what was found while researching is that 33 NIH-funded research projects on vaccine hesitancy was terminated by RFK Jr. An additional 9 grants are under review, including ones regarding cancer research, LGBTQ individuals, and also DEI. NIH officials have essentially instructed researchers to remove references to mRNA vaccine technology from grant applications. This directive has raised concerns about the future of mRNA research, which has been pivotal in developing vaccines for diseases like COVID-19, influenza, and certain cancers. While no formal ban has been announced, the guidance suggests a potential deprioritization of the research in this area. I will tell you just, in this week, on Tuesday, RFK Jr. ordered the lab studying deadly infectious diseases to stop research. Like, that's a good thing. The lab studying deadly infectious diseases has just been ordered to stop its research. He put an indefinite pause on the NIAID, Integrated Research Facility, which is within NIH. They are tasked with studying Ebola and other deadly infectious diseases, as many of them, of course, are spreading right now across the world. And they've just been ordered to indefinitely stop research activities. This is from reporting from Wired. Quote, according to an email viewed by Wired, the Integrated Research Facility in Frederick, Maryland, was told to stop all experimental work by April 29th at 5 p.m. The facility is part of the National Institute of Allergy and Infectious Diseases and is located at the U.S. Army Base Fort Detrick. It conducts research on the treatment and prevention of infectious diseases that are deemed high consequence, those that pose significant risk to public health. It has 116 employees, including federal workers and contractors. The email says representatives from the Department of Homeland Security were padlocking freezers in biosafety level 4 labs, those with the highest level of biosafety containment used for studying highly dangerous microbes. Only about a dozen BSL-4 labs exist in North America. These labs work with viruses that cause Ebola, Lassa fever, and Marburg, types of hemorrhagic fevers. The integrated research facility is one of the few places in the world that is able to perform medical imaging on animals infected with BSL-4 agents. Quote, "The sacrifice to research is immense," said Gigi Granval, a senior scholar at the Johns Hopkins Center for Health Security, on the closure. Quote, "If things are unused for a period of time, it will cost more money to get them ready to be used again. The facility's director has also been placed on administrative leave," according to the email. So the entire team, the entire 168-person team that does a great job, by the way, of investigating deadly infectious diseases, has just been ordered to stop working indefinitely. Agents from the Department of Homeland Security have padlocked doors, and presumably they're not going to get back in. Because, of course, for RFK Jr., this is not a priority anymore. Let's stop investigating, let's stop investigating deadly infectious diseases. I mean, this is the same person that has said we should put a moratorium on releasing, infectious disease reports to the public because, of course, infectious diseases, those aren't essential. I should also note here that the Trump administration plans to cut $40 million to HHS. And RFK Jr. is completely in favor of that because HHS is redundant. We do the same things. We have too many departments. Sir, all of those departments have meaning. All of those departments and all of those officials have meaning. In doing research for this special report, I have heard of programs and departments that I never knew existed. But we are all better off because they do, and because those officials have jobs. But of course, let's just go slash $40 million to HHS. And then also, let's slash an additional $47 million to NIH, the world's largest health research center. I spoke to Science Magazine reporter Dr. Meredith Wadman about this and the massive changes at HHS. This was our interview on April 18th of this year. Dr. Wadman, we have seen, of course, the ascension of RFK Jr. to lead HHS. And since then, thousands of employees have been fired. And there recently was his false conspiracy theory claims about autism. In terms of the gutting of the agency and what's happening at HHS, what is the environment like? I know it's particularly concerning for, employees, but also the status quo of the agency's future.
Well, we're seeing a reorganization of HHS that's, I think, unparalleled, at least in recent memory. RFK Jr. is proposing to create a new agency called the Administration for a Healthy America, and he will take some pieces of various other agencies that are currently within the Department of Health and Human Services and reconstitute them in this new AHA, as it's called. What that will look like remains to be seen, but we do know from a document that the Trump White House put out yesterday that many, many programs have been eliminated or will be in the Centers for Disease Control and Prevention, for instance, as this new program is, or this new agency is created. The new budget that Trump would like to see put in 2026, and that RFK Jr. is presumably working from as a blueprint, would cut $4 billion from the $9 billion budget of the Centers for Disease Control and Prevention, so 43%. And it would cut 21 billion from the $47 billion National Institutes of Health, the world's largest medical research funder. So it would basically cut it to 27 billion. That's the last time that NIH had a $27 billion budget was in 2003. So we are
Wow.
talking about catastrophic change at these agencies if Congress accepts this budget that Trump and RFK Jr. are proposing to go into effect in the fiscal year 2026, which begins in October.
With these massive cuts to NIH and the FDA and, firings at the CDC, what exactly is, that type of effect going to have on the public in terms of widespread proportions for the public being able to access information that they need in terms of, the CDC's MMWR? What kind of changes can we expect to see and things that we should be worried about?
I think time will tell. We do know certain functions of CDC are going to go away and, in fact, have already been eliminated. For instance, a small team of scientists that tracks the numbers of traumatic brain injuries and concussions and does a concussion training program for trainers and coaches and high school teachers that has been used by more than 10 million people. That's going away.
Mm.
So is a Bible of contraceptive guidelines. That team at CDC has been wiped out. And you can go down the list. A registry of people with amyotrophic lateral sclerosis, that really fatal, very difficult neurological disorder, also known as Lou Gehrig's disease. It's thought that environmental toxins could contribute to or trigger this disease. And so there's a registry that CDC has been keeping of people that get it and their environmental exposures. That's going away. Just entire functions that are really key to public health are going away. Oh, and by the way, including monitoring children's blood lead levels. As you
Wow.
know, lead in kids' blood causes neurological damage that is lifelong and catastrophic.
This comes at a time where we're seeing a resurgence of measles and bird flu across the nation. Um, because most of these agencies now are not going to be adequately staffed and funded, how is that going to not only harm, the states and also you know, other health agencies in terms of responding to these local crises? And I guess my question here is from the big picture, how likely are we to face some type of virological crisis because we're cutting staff and, cutting essential funds to these agencies?
I'd say the likelihood is high. What exactly that will look like, we don't know. Whether it becomes because the bird flu that's now simmering in our cattle and fowl uh, suddenly or mutates and becomes contagious between people. That could be, one biological emergency that we're just not going to be as prepared or equipped for.
Hmm.
It could be something that looks very different and that's maybe more subtle. When you kill $20 billion of research funded by the National Institutes of Health, there goes that Alzheimer's study that maybe can't help your grandmother who has Alzheimer's, but might help the next generation. And so we wouldn't see the costs of that immediately, but they're there. They're very real.
What have your conversations been like with officials in these health agencies and in the health field that are concerned about what's happening here?
Conversations have been almost all anonymous because people are scared. I've
Yeah.
spoken with very senior officials at both NIH and CDC. And I would say the uniform adjective I would use for these folks is somewhere between despondent and despairing. It's really hard to watch what you have spent your livelihood sacrificing in some cases to do work that, you could have been off at a drug company making a lot more money, but you wanted to go into public service. To see that all just being taken apart in a mindless and unscientific way,
Hmm.
not with any regard for can we find real waste here and carefully trim away things that are maybe excessive, but let's just take a battering ram to it. People are just got gobsmacked, really.
I'm curious to know if there are any efforts to essentially save or prioritize some information within these agencies because, essential programs like, what's happening in regard to USAID and, PEPFAR and some of the research grants that have been done at NIH and all these other health agencies. Um, have you do you have any insight if to anything is being saved for the public's access or for public information in terms of information that's imperative?
I know that ad hoc groups have sprung up to back up CDC data and other kinds of data that have
Okay.
gone down or been eliminated, particularly around transgender and DEI issues. I don't think it can be said that's being done in any kind of systematic way. And there
Mm.
are some functions that are being preserved. For instance, maternal mortality data is collected by a team at CDC. That team has not been fired.
Okay.
But another particularly important survey around the health of women during and shortly after pregnancy is going away, is being eliminated. And the loss is just, you almost can't describe it in words, really. This is a survey that's been going on since 1987, and you can go in and find out like what happens, what's the data showing us about when people smoke in pregnancy, or if they are breastfeeding, what contraceptive might be safe. These very deep and highly relevant pieces of information for people. Just you can't replace those if you wipe them out overnight. And also the people who have decades of experience with them, you don't just snap your fingers and say, let's bring it back 2 years from now.
Mm. And to your point there, I guess what I'm going to ask here in my last question um, is what's happening, what the Trump administration is doing in regard to these massive cuts and dismantling these health agencies. Are they doing this in a way that's irreversible and that's going to have, decades long effects in terms of rebuilding?
Yeah. I should I should be clear that the massive cuts I just described, for instance, the 20 billion coming out of NIH,
Hmm.
44% of its current budget, that is not a done deal. Congress has to agree to that.
Okay.
And so if you have listeners who are concerned, they should contact their Congress people. That's, you know, something that is not yet effectuated. As for things that have already been taken down, no, you can't get those back quickly. You can't, it's not like turning off or on a light. It's
Mm.
more like, shutting down a house and turning off the heat and coming back in 3 years. It's going to be full of cobwebs and rust, and it's maybe going to have to be demolished.
That was my interview with Dr. Meredith Wadman, a staff writer for Science Magazine. This was recorded on April 18th, and since then, the CDC's maternal mortality team has been disbanded, along with other government health tracking programs, including the CDC's teams for abortions, job-related injuries, poisonings, sexual violence, and youth smoking. All of those programs have now been terminated. I should also mention that the CDC's cruise ship health inspection team has been fired. They were responsible for responding to disease outbreaks on cruise ships, conducted surprise inspections of cruise ships twice a year, published guidelines to help ships meet U.S. sanitation standards, maintained a public database of cruise ship inspection scores, and ensured the safety of portable water systems. That team, the VSP, the Vessel Sanitation Program, no longer exists. The Trump administration and RFK Jr. have also ended the CDC's flu vaccine campaign. There was news earlier this year that essentially the CDC's disease detectives had been fired. That was true, but now as of yesterday, they will be exempt. So we're going to keep the epidemic intelligence service officers for now. I mean, that's good news, but look what they just did here. This is exclusive reporting from NBC News earlier this week. The Trump administration has shut down the CDC's Infection Control Committee. They have shut down the CDC's Infection Control Committee. Quote, the Trump administration has terminated a federal advisory committee that issued guidance about preventing the spread of infections in healthcare facilities. The Healthcare Infection Control Practices Advisory Committee crafted national standards for hand washing, mask wearing, and isolating sick patients that most U.S. hospitals follow. 4 committee members said the Centers for Disease Control and Prevention delivered the news about the committee's termination to members on Friday. A letter reviewed by NBC News, which members said the CDC sent out after a virtual meeting, said the termination took effect more than a month previously, on March 31st. According to the letter, the termination aligns with President Donald Trump's executive order calling for a reduction of the federal workforce. 4 professional societies previously asked Health and Human Services Secretary Robert F. Kennedy Jr. in a letter on March 26 to preserve the committee amid widespread cuts to federal health agencies. The CDC and the Department of Health and Human Services did not immediately respond to a request for comment Tuesday. Several of the committee's web pages have been archived, meaning they are still available to view online, but are no longer being updated. Some members now say that they fear its guidelines will be frozen in time, unable to evolve with new scientific research or the spread of drug-resistant organisms, which are a particular threat to hospitals. End quote. So the CDC's committee on investigating essentially infectious diseases, which lots of hospitals follow, that committee has officially just been disbanded. It has been shut down by the Trump administration. It's a part of Donald Trump's executive order to reduce the federal workforce. As I said, all of this is happening not with just callousness. All of this is happening because it is as a result of this, Project 2025. All of this was planned. This was a premeditated assault on America's public health agencies, but it is happening right now on a scale that is going to have devastating and lethal ramifications. Many of them are irrevocable, by the way, as I spoke with Dr. Wadman about. And now we are facing this crisis. I mean, what good does it serve you to shut down the CDC's Disease Infection Committee? What good does that serve you? This story gets worse, though. And this special report is long, but it is necessary, and all of this information is horrifying. We're going to take a quick break, and when we come back, I'm going to take a look essentially at the groups behind RFK Jr. and their influence on his thinking as multiple communicable disease outbreaks are spreading across the country, and what the shuttering of public health agencies means, not just at the federal level, but also in the states. Stay right there. The Jeremiah Patterson Show is an independent news media platform. If you want to see more special reports like this, please consider becoming a paid subscriber to my Substack at tjpsnews. When you become a paid subscriber, you'll get immediate access to exclusive content, opinion pieces, the upcoming Resistance podcast, and The More You Know, a series focused on diving deeper behind the headlines with historical context. One viewer who upgraded said, quote, "Your show is insightful, thought-provoking, and engaging. You shed light on key issues, inspire conversations, and tell impactful stories. Your passion and dedication shine through in every piece, keeping me informed and inspired," said Dr. Lisa. "I do this because it matters, because the investigative journalism is imperative, and most of all, I'm unabashed and unafraid to tell the truth. Upgrade now from free to paid for just $7.99 a month or $75 a year. This guy is Del Bigtree. He is a prominent anti-vaxxer. He said that vaccines cause autism, which is false. He called COVID a scamdemic and claims that thousands of people died from its vaccine. He believes that vaccines are a ploy to essentially enslave humanity, and public health policies and vaccine mandates are a part of a tyrannical government. Quote, "This is modern day slavery. Vaccination is the mark of the beast." In addition, Bigtree compared vaccine mandates to the Holocaust, saying it's like Jews when they were persecuted. He then says essentially that natural infection is better than vaccination, which is, basically the idea that we should all get everyone together that's sick. And then, we should just all have like a huge sick party and we'll all develop herd immunity because our immune systems will just get used to it. Bigtree claims that the CDC and the World Health Organization are part of a conspiracy to kill the public. He has promoted so much dangerous misinformation with lethal ramifications that he has been deplatformed and banned by YouTube and other major tech companies. And I'm not bringing this up for no reason. Del Bigtree is very closely associated with RF Kennedy Jr., the nation's Secretary of Health and Human Services. This is a super PAC he founded called MAHA, Make America Healthy Again. You can buy hats, t-shirts, mugs, and even a bag. And because they are a real group, because they are a real organization, I decided to call them yesterday. And to my surprise, this is what happened.
The Google subscriber you have called is not available. Please leave a message after the tone.
Interesting. This would be a corporation, so, okay, wow. It says, MAHA, action exists to revive and empower a healthier America free of corporate interest for the health and prosperity of our communities and our country. Let's try calling one more time. So once again, that's 301-278-8845. It is 10:03 a.m. here on the East Coast. Let's call again.
The Google subscriber you have called is not available. Please leave a message after the tone.
Wow. Okay. They do not pick up the phone. Huh. 2 failed phone calls, and it's a Google Voice number. Now, there is nothing wrong with Google Voice. It's just that Del Bigtree is like a wealthy guy, and you think that you'd have a legitimate number to call for his MAHA Super PAC, but apparently not. I called again multiple other times yesterday, and today when I woke up, I called again, but still nothing. It does the exact same thing. So yesterday, I decided to leave an email inquiring about MAHA's public health agenda and their influence on RFK Jr. and what they thought of his leadership thus far. You can see it's from the tjpsnews Gmail account to MAHA Action's press email. I essentially told them that I was doing a special report on the dismantling of public health agencies in the United States and how doing so would make America healthy again. I gave them a deadline to respond, and still as of today, as of this afternoon of me recording this, they did not respond to a request for comment. I didn't even get a no comment, which in journalism is something. But it is important for all of you at home who are watching this to know that Del Bigtree has RFK Jr.'s ear and how dangerous that is. He said that RFK Jr. should handpick vaccine scientists. And so he sought to essentially get full access to the FDA's vaccine safety database. Reportedly, Kennedy wanted complete unrestricted access to the database. Dr. Peter Marks, who is over it, did not comply with that directive because he feared they would manipulate or even delete it to further their agenda. He told the Associated Press when asked why he didn't grant access, quote, "Why wouldn't we? Because frankly, we don't trust them." He said, using a profanity, they'd write over it or erase the whole database. This week, RFK Jr. officially filled Dr. Marx's position with Vinay Prasad, who is known for writing scathing critiques of the FDA. During COVID, he was sharply critical of school closures, universal masking, and booster shot recommendations. He is against vaccine mandates, calling them unethical. He will now be the top vaccine regulator at the Food and Drug Administration. In regard to sensitive databases, though, Wired reported in April that there has been a breach by Doge. Elon Musk and his gang of teenagers were granted access to 19 sensitive systems at HHS, including one where access was granted without proper security training. Per this reporting, Doge has access to the accounting systems for all Centers for Medicare and Medicaid Services programs, and several HHS accounting systems that pay government contractors. By having access to the Healthcare Integrated General Ledger accounting system, which pays out federal grants ads, is used for Medicare and Medicaid services. Doge apparently could theoretically cut off Medicaid payments to the states. So by having access to this system, Doge essentially could just cut off Medicaid payments to the states completely. Think about how dangerous that is here. And because of how intrusive and disconcerting this is, Doge was sued by a labor union for violating privacy acts. Judge John Bates ruled that this lawsuit could move forward, so this is now pending litigation. But according to this 34-page court filing that I reviewed for this special report, it's laid out how one employee went through the right channels in order to get essentially access granted to this sensitive HHS system. And on the contrary, these were also systems that Doge employees Luke Ferreter was granted access to without proper security training. Edward Korstein, another Doge employee, was also granted read-only access to these three systems. Wired did an incredible job at pulling together the programs in the sensitive database and who now has access to it. These databases include social security numbers, financial account information, taxpayer IDs, and they've gotten access to the NIH's research grants application system, the system for unaccompanied migrant children in the United States, the Consumer Financial Protections Bureau, and more. An attorney representing the labor union suing to end Doge's access essentially asked Jennifer Wendell, who is the chief enforcement officer at HHS, quote, "Do you know if the Doge team affiliates have literally just shown someone outside HHS records?" Quote, "I do not know that." Wendell responded, "This is the chief enforcement officer at HHS, and she doesn't know." This is a colossal failure. This is a complete disaster. I mean, the incompetence here is horrifying. When you talk about other agencies that are being dismantled, yes, that is deeply concerning and equally as horrifying. But consider the broad implications here. Consider the broad, devastating, and lethal ramifications for dismantling the Department of Health and Human Services in a way that is so chaotic, that is so demonstrably disastrous, that is so incompetent, that it's going to have broad consequences here. I mean, you talk about dismantling this department in a way like this. These are life and death consequences for doing so. I mean, we are talking about Doge having access to highly sensitive databases, and who knows what's being done with that information. The major cuts, and in many cases full-on axing of essential health programs and procedures mixed with broad incompetence, are inevitably going to create an out-of-control epidemiological crisis in this country. The FDA has suspended milk safety testing. The Trump administration is also considering eliminating the CDC's HIV prevention division. Like, that is a good thing. And when RFK Jr. was asked about these broad cuts at HHS, he appeared to be confused.
Proposed more than $11 billion in cuts to local and state programs addressing things like infectious disease, mental health, addiction, and childhood vaccination. Did you personally approve those cuts?
No, I'm not familiar with those cuts. I mean, we'd have to go. We'd have to go.
There's like more than 50 pages of cuts that I actually went through.
The cuts were mainly DEI cuts, which the president.
There were a lot, but I'll give you, for example, about $750,000 of a University of Michigan grant into adolescent diabetes was cut. Did you know that?
I didn't know that, and that's something that we'll look at.
This is the Secretary of Health and Human Services, and he didn't know that such massive cuts were made at HHS regarding infectious diseases and other things. This is the Secretary of Health and Human Services. So did someone else just make the cuts for you? My gosh, this is the government. On Monday this week, Stephen Hatfield was picked to be the special advisor at HHS. Of course, he's going to be working closely with Robert F. Kennedy Jr., leading the Pandemic Prevention Unit. He previously served under Trump's first term, where he touted hydroxychloroquine as a way to treat COVID. Because, of course, that is not a way to treat COVID. In fact, that was a conspiracy theory that was promoted by Donald Trump, among other officials, as a way to treat COVID. Yesterday, Trump chose Casey Means to be the Surgeon General, the Chief Medical Officer for the United States. This is after the first nominee withdrew after concerns about her medical background. But this one isn't any better. She is a Maha influencer and a wellness influencer. This essentially was Donald Trump responding to a reporter when asked why exactly he picked her when she is absolutely not ready for the role.
You just announced a new nominee for the U.S. Surgeon General who never finished her residency and is not a practicing physician. So can you explain why you picked her to be America's top doctor?
Because Bobby thought she was fantastic. She's she's a brilliant woman who went through Stanford, and as I understand it, she basically wanted to be an academic as opposed to a surgeon. I think she graduated first in her class at Stanford, and Bobby really thought she was great. I don't know her. I listened to the recommendation of Bobby. I met her yesterday and once before. She's a very outstanding person, a great academic, actually. So I think she'll be great.
Once again, that is Donald Trump in the Oval Office, appearing to be confused because it wasn't his pick. Bobby Kennedy recommended her, so of course I'm going to put her on. Despite the fact that you're the president of the United States and you have a huge team where you could, do research on the officials that are being put into HHS, just let's put some random people on there, including people who haven't even completed their. Considering this on a broader scale in terms of the massive cuts at HHS and what's happening to dismantle public health agencies in this country, this also comes at a time where we are facing multiple epidemiological fronts here. I mean, there is bird flu, listeria, E. coli, measles, tuberculosis, and dysentery. All of those infectious diseases have resulted in outbreaks just this year. Measles is among the worst, which has now surpassed 1,000 cases in the United States just this year, the second worst since it was declared eliminated in 2000. Multiple counties and states are on high alert. Yesterday, North Dakota became the 11th state with a measles outbreak. Vox had some great reporting yesterday, essentially on how bad things had gotten. That's the year 2000 when it was eliminated here on the graph. Look at this. We're on track to pass 2020. And according to this graph, the current U.S. outbreak has led to the most measles cases in a single week since the 1990s. Goodness. Fewer Americans now believe it is important to get their children vaccinated, and only 11 states have 95% or more of their school children vaccinated. And this is just diametrically frightening because this is not normal at all. But nonetheless, federal funding cuts have led to the cancellation of, dozens. Excuse me, I said cancellation. I don't think that's a word. Cancellation of dozens of free measles vaccines clinics and public health workers to be laid off in Texas. In Texas, out of all places, because that's the epicenter of the nation's largest measles outbreak right now. And RFK Jr. has promoted 2 doctors in Texas who say that if you get measles, an asthma inhaler can heal you. And mass infection is, quote, God's version of measles immunization. So, of course, if you get measles, you can be healed by just getting an asthma inhaler. And also, measles as an outbreak is where do these people come from? Goodness. RFK Jr. himself wrote a book saying that measles outbreaks have been fabricated to create fear and believes that children catching it will be great for them because it'll help them battle cancer and other diseases. So it's like a cool superpower if you catch it as a kid. Despite it being highly contagious and also lethal, this is what he believes, and he's promoting those same quack, unsubstantiated theories as the Secretary of Health and Human Services. I'm going to keep saying that because you have to underscore how insane, how absurd this is, how asinine and wild this is. RFK Jr.'s Make America Healthy Again campaign is not just happening at the federal level, though. It's also expanded to multiple different states. He is strongly against fluoride in the water, calling it an industrial waste that gives you arthritis, bone fractures, IQ deficiency, and cancer. Now, all of that has been proven false because it lacks scientific research and also logic, but he has directed the CDC to stop recommending community water fluoridation. I have this report has been a long time in the making. I've read so much, but I'm here because I'm doing this because investigative independent journalism matters. So excuse me here, gonna pull through. So that has just happened. RFK Jr. also announced the formation of a task force to reevaluate the safety of fluoride in drinking water. The American Dental Association maintains that water fluoridation is a safe and effective measure to prevent tooth decay, reducing dental cavities by at least 25% in children and adults. The CDC continues to recommend community water fluoridation as a cost-effective public health strategy. But the states are following RFK Jr.'s lead on making America healthy again, right? Because maha. In March, Utah became the first state to ban fluoride in public drinking water. RFK Jr. celebrated that decision, and since then, other states plan to follow along. Florida Republican Governor Ron DeSantis said this week that he will sign a bill which will ban fluoride in public drinking water for the state of Florida. This will make them the second state to do so. And as this movement is picking up steam in the states, there is one Republican governor that is going full ahead here. Governor Mike Braun of Indiana. He signed 9 executive orders to make Indiana healthy again because that's his trademark. And this looks like banning residents from using SNAP to buy candy and soda. Protests have already started in response to what Governor Braun is trying to do there, dismantling the state's public health agencies and changing the way that things are done. In the northeastern United States, the Trump administration has been telling local and state health agencies to, quote, immediately terminate to the maximum extent DEI programs and comply with executive orders aimed at dismantling their agencies. 19 states and Washington, D.C. are now suing the Trump administration over mass layoffs and the dismantling of HHS. The attorney generals are calling it arbitrary and capricious. This is from their lawsuit, quote, incapacitating one of the most sophisticated departments in the federal government implicates hundreds of statutes, regulations, and programs. But Secretary Kennedy refused to undertake this restructuring legally or carefully, dismantling HHS by terminating the people necessary for it to meet its own mandates and paralyzing it by means of a confusing organization is an unlawful effort to undercut the will of Congress, who ordered the agencies and programs to run. More Americans will suffer from illness, injury, and death without these common sense programs. A robust public health system that serves communities with the most barriers to appropriate medical care is vital. So, what we are watching here is the mass convergence of public health officials also kind of fight back here. They're kind of fighting back because what's happening here is so insane. So again, those 19 attorney generals from 19 different states and also Washington, D.C. have sued the Trump administration for what they're trying to do here to dismantle HHS, which is going to be extremely dangerous, extremely lethal. A lot of it is already irreversible. And it's worth covering what's happening in the States, right? It's worth covering what's happening here in the United States because the response has been incompetent. It has been disastrous. It has been chaotic. But it's also noting that what the Trump administration is doing to dismantle public health agencies has broader ramifications worldwide. Because, I talked about, the CDC, right? The CDC is one of the agencies that we have here that is stellar on scientific research and infectious disease reports. They do all kinds of things. NIH, one of the world's largest research scientific organizations, right? NIH, huge. The FDA, the Food and Drug Administration. These major agencies, along with their other, subsections of the agencies like the infectious disease committees and everything, these agencies are so influential that they just do not help or are useful or of convenience medical-wise to us here in the United States. They're also heavily relied on across the world. I mean, the NIH, the CDC, and the FDA are looked at across the world here. Talk about the world, the world implications. But it's also programs like USAID. USAID, of course, which is huge. It does a lot of things, but among it, what they do is, they send out teams to go to countries like Uganda to work on the Ebola outbreak there, to essentially, keep that under control so that does not spread around the world, becoming a global pandemic. They administer, HIV drugs to people across the world, polio vaccines, AIDS vaccines, and, support, not vaccines, but, treatment. What has just been done to public health agencies, not just in the United States, but also the gutting of these agencies, and USAID being among them, has worldly disastrous consequences. I mean, millions of children are now going to die in the upcoming future from polio as USAID is going to be dismantled, has been dismantled effectively. HIV and AIDS, they are going to spread around the world like a wildfire because we have dismantled those teams that USAID has dispatched across the world to heal and to help other people across the world who are fighting these infectious diseases. Dismantling programs like PEPFAR as well. This has disastrous, broad complications. This has gargantuan, catastrophic complications for the rest of the world. It's not just the United States and local and public health agencies that are struggling, that are getting attacked. It's also the world here. I mean, think about what's happening. The World Health Organization has said that a new pandemic could come anytime soon. It could be anything, right? We have left the World Health Organization. We have dismantled USAID. We are dismantling public health agencies here in the United States that also the world relies on. Think about how devastating that's going to be and how bad that is. I spoke with John Cohen. He's a distinguished senior correspondent at Science Magazine about all of this and more on April 18th of this year. This was our interview. How detrimental are these massive cuts and the dismantling of these imperative health agencies?
It is completely obliterating decades of partnerships that have been built up around the world in scientific research. And the dismantling of the PEPFAR program, which is started by George Bush, that is one of the most heralded foreign assistance programs from the United States of all time, has saved more than 20 million lives, people who are living with HIV by providing medicine. And beyond the PEPFAR program, there are networks that test vaccines, that test new drugs, that are heavily reliant on international cooperation. And the United States government has provided the funding for these networks for decades, and the networks are severely affected now. And so the ability to find new medicines is going to be compromised. It's going to take longer. It's going to be more difficult. And it is going to lead to more people becoming ill and more people dying.
The Trump administration has basically eviscerated USAID, which, among other things, is responsible for, providing many nations, including those less fortunate, life-saving drugs and vaccines. According to your reporting, Trump's cuts have damaged global efforts to track diseases and prevent outbreaks. You talked about PEPFAR just there. The former director of that program told you in an interview, quote, "If we despair, then it becomes catastrophic. I don't want to be known as the generation that despaired and dropped the ball on global health." What was your assessment of that interview and how much of an existential crisis this is going to be for global health?
I think most everyone who is at the front of this is in shock still that the US government, which has been a leader in the global health world, is just washing its hands of it. And there are many reasons why we benefit from assisting other countries. One is that, as people love to say, you know, these pathogens, these viruses, these bacteria, they don't respect borders. They don't care.
Yeah, exactly.
And if drug resistance crops up in one place, it's going to crop up in another. And you know, look what happened with COVID. It taught many people about how variants move around the world. Omicron was first detected in South Africa. And because they had a good network available to detect it and sequence the virus, we knew ahead of time that, hey, the vaccine we have, it's probably not going to work against Omicron. We can start retooling our vaccines. That's just one of many examples of the way we're interdependent upon each other. And then there's the soft power aspect to it, where by being a good global citizen, the United States wins friends in regions of the world that can prevent other, you know, social problems and civil wars can be avoided. I mean, it's a cascade of events that happen from well-spent global assistance. The essence of this, in my mind, is you can improve almost any government organization without question. But this is trying to fix a clock with a hammer.
Yeah.
And I think that's the real shocking aspect to this is it's not that everyone's saying we're doing things perfectly, but if you're going to tune something up, tune it up. Why destroy it? And
exactly.
You know, and PEPFAR is a really interesting example because PEPFAR is extremely transparent about where the money goes, and it's not to say that it couldn't be spent more efficiently, but they have metrics that are real. You can look at how many HIV tests they do, how many pills they distribute, how many pre-exposure prophylaxis injections they give of the drug cabotegravir. You can do a metric on all of these things and ask, is it money well spent? And again, analyses by independent bodies have said yes. And so then to just come along and say, okay, bye. It is, you know, it's just unbelievable head scratcher. Why would you do this? And the other aspect to this, and I'm going to stick on PEPFAR because it's a multi-billion-dollar program over many years. There has been a plan to phase PEPFAR out. And it was happening with cooperation from the countries receiving assistance and was going to take another 5 years so that it's sustainable for these countries.
Wow.
And now it's just like, pull the plug. Good luck.
I mean, absolutely, because I mean, in regard to not just global health, but also what's happening here, we've seen quite a resurgence in multiple communicable diseases like measles, bird flu, and tuberculosis. With such massive cuts here and doing things like eliminating, $40 million from HHS's budget and scrapping the CDC's plan to help stop measles from spreading more in Texas schools, how worried are you that not being adequately funded and staffed to handle, such a epidemiological situation right now, that we may face an out of control virological crisis in the future?
Well, we will face with the best, any way about it, we're going to face virological crises in the future. The Trump administration during COVID, Donald Trump said, let's not test so that we won't see cases.
Yeah,
it's this illogic, like it's this ostrich philosophy.
Yeah,
and a lot of the problems that are going to come from underfunding of public health and global health will take a long time to manifest. And you won't see people dying tomorrow. It doesn't happen. It doesn't work that way.
Yeah.
But, you know, there's a Bob Dylan line, you don't need a weatherman to know which way the wind blows.
Mm-hmm.
It's obvious what is going to happen by underfunding these things. We've set up over time these very elaborate partnerships that are very similar to our defense strategy with military. And it is about defending us from the onslaught of pathogens. That's what this is about. We're really interested in keeping people alive. I've worked in more than 50 countries on the ground. I've yet to go anywhere in the world where people don't value health. Everyone, everywhere wants to be healthy. They want their children to be healthy. They want their parents to be healthy. They want their dogs, they want their goats to be healthy.
Exactly.
There are a few things that everyone everywhere wants. And health is this one thing that we all desire in our lives. And the US government has been exemplary in funding basic research through the National Institutes of Health and the National Science Foundation, applied research, creating medicines, and then using strategies to share those things around the world. The US has played such a central role in all of that. And to take the US out of the equation is going to cause problems. Two trains are heading for each other.
Mm-hmm. Just hypothetically here, last question. If there were to be like a new administration, conceivably, how long would it take to reverse the damage that has been done here?
Jeremiah, it's a great question. I don't know. Some of the damage can't be fixed. It's about trust.
Yeah.
How do you repair trust? It
Exactly.
takes a very long time to build trust. You had participants in clinical trials, people who were volunteering their bodies, who suddenly weren't getting the medicine, and it puts them in harm's way. When you do that to communities, well, how do they feel about you coming back tomorrow and go, "Hey, we've shifted gears, everything's fine"? Like we don't want you. I mean, we're going to run into that. That's inevitable. If there is a review going on, foreign assistance, that's going to take another month. It could be that the Trump administration changes its mind and shifts gears, and that would be welcome, and people would very quickly benefit from it. But is it going to undo the damage? You can't unring a bell. So we'll see. I just don't know.
Once again, that was my interview with John Cohen, a distinguished senior correspondent at Science Magazine. I mean, that is just, it's heavily concerning. That's deeply concerning. I spoke to him on the same day that I spoke with Dr. Meredith Wadman. And once again, along those same lines, saying that a lot of what's been done here is irreversible. I mean, it's going to be decades and centuries of devastation here. I want to play you this last clip here on the show before I end the report. This is Senator Jon Ossoff also speaking about the consequences of what the Trump administration is doing.
Who out there in the American public is sitting at home demanding that we shut down cancer research and Alzheimer's research? We're going to pay for this not just in lives and children's lives right now, but we're going to pay for this for a century. Irreversible damage has already been done, and it's an outrage. And I hope that this hearing demonstrates that there's bipartisan rejection of these policies here in the United States Senate, and I hope that we'll follow up this hearing with real action.
Once again, that is Senator Jon Ossoff of Georgia speaking about the devastation of what the Trump administration is doing and how this is going to impact millions, not just here in the United States, but also worldwide, as a lot of people are going to die as a result from this. Thank you so much for watching this special report. I hope you enjoyed it. If you want to see the behind the scenes of this special report, how it was made, the research process, and everything that went into this, be sure to subscribe to my Substack at TJPS News. But in order to access the behind the scenes, the making of unprotected America's health agencies dismantled, you have to become a paid subscriber. So if you would like to upgrade to become a paid subscriber of my work, you can upgrade now to that. That is tjpsnews.substack.com. You can become a paid subscriber for just $7.99 a month or $75 a year. So I appreciate all of you so much. Please be sure to comment any suggestions, questions, or your thoughts on this video. If you are a fan of the Jeremiah Patterson Show, please recommend it to your family and friends. You can also support us by donating financially, as this is independent journalism and we rely on your donations to continue this crucial work. A huge heartfelt thank you to all of you who have supported my work by becoming paid subscribers, donating to the Jeremiah Patterson Show financially, or getting my book Resistance. Also, I want to say here that you can be sure to follow us on Substack and Blue Sky at TJPS News, of course, where news updates, hot takes, comments are posted on there. If you have any questions, news topic requests, or want to do collaborations, you can email me, tjpsnews@gmail.com. Thank you everyone so very much for watching. I look forward to chatting with you in the comments. And yeah, take care.